Welcome to the Compounders Podcast. On this show, we explore the topic of compounding from various angles, including through interviews with public and private company executives, investors who focus on compounders, and newer investment firms that are building a business they hope will become more valuable over time. All opinions expressed by your hosts and the podcast guests are solely their own opinions and do not reflect the opinion of SNN or its affiliates. This podcast is for informational purposes only. It is not investment advice and should not be relied upon for any investment decisions. We are not recommending the purchase or sale of any securities. The host and guests may be beneficial owners of the securities discussed. You should not assume that the securities discussed are or will be profitable. My guest on the show today is Jim Cunniff, the CEO of Electromed. Electromed is best known for its main product, the SmartVest, a medical device that helps people with a chronic lung condition breathe easier and have a better quality of life. After working at Baxter and Stryker, Jim became CEO in 2023 and has brought a new level of focus and urgency to Electromed. In this conversation, we covered why Jim decided to take the CEO role at Electromed, what is special about SmartVest as well as drivers of growth, why bronchiectasis remains an underdiagnosed condition, what he has learned from being an operating partner at Shore Capital, and how the company generates 70% plus gross margins. For full disclosure, I am not an Electromed shareholder. And without any further ado, here's my conversation with Electromed CEO, Jim Cunniff. As always, we will start this podcast off at a pivotal moment in the company's history. Jim, you joined as CEO about a year ago. After working at bigger healthcare firms such as Baxter and Stryker, what did you see in Electromed that intrigued you?
Okay, well, I learned a lot of healthy habits and best practices by leading businesses in larger organizations. But Ben, as you know, they can become inwardly focused and bureaucratic. I guess what I was intrigued by Electromed is because of the company's mission to help people breathe easier and live more active lives. The company's size, the market opportunity, and the prospects for growth where I could have an immediate impact and take us into our next phase of growth.
And as you were discussing with the board the opportunity to join and you finally signed on the dotted line, what was your mandate from your perspective?
Well, I inherited a healthy business, but I did not have a couple of, I should say, have a couple of mandates. The first, and probably not a surprise, is explore areas for growth. I think the second of which is increase shareholder value. And, I think now a year into this, I think we've rung the bell on both of those fronts. On the growth front, we've posted 6 quarters in a row of mid-teens revenue growth. We've added sales representatives to grow our hospital business, which is up over 25% versus prior year. We've improved our customer service. We introduced a program called Smart Advantage, which really helps our clinics navigate not only the payer landscape and getting access to our product, but also what are some of the reimbursement requirements. And actually, we've added a couple of DMEs to augment our direct team and to support our number one, to provide, we did that to augment our direct team, but we also did it to support our providers because we've got over 50 feet on the street, but we aren't able to cover the entire landscape. So going through a couple of DNEs helps us do that and expand our payer coverage. I think the last thing is our stock has appreciated over 40% since I started a year ago. And most recently, we were recognized as one of the fastest growing public companies in Minnesota.
Which is a place we were talking about before we started, a place where there's a lot of public companies. So it's actually not a low bar at all. And so this company's been around since the 1990s and it's been public since 2010, but it really feels like there's been an inflection point of some kind and this company's started to hit its stride. I'd love for you to talk a little bit about that. I assume some of that is you, but some of that was the infrastructure and the foundation that was laid before you became. So I'm interested in that 6 consecutive quarters that you've been growing kind of double digits. What do you think is driving that? Was there a discernible inflection point of some kind?
Well, I think if you take a look back, as I mentioned to you before, I inherited a healthy business, which is not typical in my history of being able to do that. So I was fortunate in that respect. But I think really the inflection point happened after we announced record revenue and earnings in Q2. And the market appreciated that the business could not only grow revenue, but also increased operating leverage. And I think we've been able to do that, Ben, because in the past we've invested in people and process and technology. And we have a relatively new ERP system, so that's in the rearview mirror for us, and we've been able to leverage that technology and the data insights that we're getting from that. I think we've improved the hiring profile for our sales representatives, so we're getting better talent. We've improved the training for those reps so that they can hit the ground running and be productive sooner rather than later. I think the other thing, and this is a key piece in our operating leverage story, is that in the past, when we would add a sales representative, we typically had to add one-to-one a corresponding reimbursement representative. And today that's no longer the case. We've got great leverage and productivity within our reimbursement team to support our sales efforts. And I think a consequence of that is as we grow, we're going to see increased operating leverage in our P&L.
Maybe this is the perfect time to talk about the company's main product, the SmartVest. So for people who don't know what a SmartVest is, tell us what it is and tell us also what's special about it.
I appreciate that. Yeah, it's the lifeblood of our company. So just to kind of level set what SmartVest is, it utilizes what's called high frequency chest wall oscillation. And essentially, our product is a vest, which is attached to a hose that is attached to a generator that gently squeezes and releases a patient's torso to release trapped mucus in the lungs. And I think that's really important because we have patients that we're caring for that are elderly, that many times have osteoporosis. And what's neat about our product is we have the newest product on the market with Clearway. We have the most comfortable vest on the market. This is a product which a patient is going to use every day for the rest of their lives. As I mentioned, many of these patients are older, osteoporotic, and what's differentiated about our product versus our competitors is not only is it the newest product on the market, but our vest itself is the lightest weight. So it's very comfortable for the patient to use. When they are putting it on, we use Velcro versus clips, which are hard to use if you have arthritis. Our product is smaller and lighter. And what's really cool about it is we don't have an on-off button. So it's a very intuitive patient interface. And what we believe is kind of the secret sauce is because of the comfort, because of the ease of use, we get better patient adherence. And the other thing is this is a product that's used in a patient's home, and the industrial design is awesome. It's a lot like having a larger Apple device within your living room or in your bedroom. It looks good, and we've gotten great reception from not only our providers but also our patients.
And what's the profile of an individual who needs either your product or something like it in order to be able to breathe and have a good quality of life?
Well, first off, these could be COPD patients. The subset, though, that we treat most predominantly are bronchiectasis patients. And the profile of those patients are typically female, over 65 years of age. But it really covers the gamut of why somebody would need this technology. It's typically not related to respiratory illness that they have from smoking cigarettes. It's typically something that can be environmental or hereditary. And typically we'll see these patients develop this condition as they get older in life.
And I know from looking at your presentation that you believe this affliction is particularly underdiagnosed. Do you have a sense of what that is? Does it get mistaken for other things? Maybe talk a little bit about that aspect of the market opportunity for this company.
Yeah, so I think that's one of the great opportunities that we have is that, the disease state that we serve, Ben, it is misdiagnosed, it's underdiagnosed, and the technology that we have and our competitors have is really underprescribed. The exciting thing, though, is, I'm beginning to see that there's a change with the pulmonologist most notably recognizing that bronchiectasis is really a condition that is under-prescribed and under-diagnosed. And so they're talking more about it on the podium. We're starting to see more clinical studies regarding bronchiectasis, again, which is our primary disease state that we treat. That disease state, by the way, is irreversible and it's chronic. So once a patient has been diagnosed and they have this condition where mucus is building up in their lungs and they can't release the mucus, our device is really necessary for them to release that mucus from their lungs so that they can breathe easier. But really, part of our strategy, and one of the things that we're really leaning into this year as we start our fiscal year 2025, is market development. We think this is a key area of our strategy to better educate physicians, develop bronchiectasis treatment guidelines, and really get patients on SmartVest sooner in their treatment continuum. That's one of the big problems is, many of these patients have this condition, but they try and fail another, maybe a cough assist. They're given usually a raft of antibiotics to treat the underlying bacterial infection that they may have. And they also may be taking some steroids relative to the inflation. But we believe the investments that we're making in this area relative to market development, working with KOLs, is not only something that we think is going to help the market, but I also think it's going to illuminate and ignite many of our competitors to make similar investments. And I think a consequence of that is that collectively we'll unlock this huge market opportunity. And I think that all boats, as a consequence in this space will rise.
One interesting thing in competitive strategy that I always think about is, would you rather be the only player in a market, or would you rather be a player? Would you rather be a player where there are other people who are helping promote the cause, and maybe help people understand bronchiectasis? Say it again. What is it again?
It's bronchiectasis. I know it's a mouthful.
There we go. Hard word to say, but kind of like talk about the constituents there and build it. So how do you think about that competition side? Is there some co-opetition in terms of kind of advancing the cause in addition to the kind of the day-to-day combat and with physicians?
Yeah, I would say so. I mean, I think really kind of one of the things that's a bit different with us, though, Ben, is the fact that we're a single product company. And so, we're really, our sales team, our marketing team, our direct-to-consumer teams are really out there beating the drum on education, introducing them to, what is required for the patients to get reimbursed for our product, talking to physicians about, that you've got a patient that you just put on this product and they had a great outcome. Why aren't you looking at other patients within your practice that might benefit from our technology? So I think we're really the spearhead on this because of our focus on this market today. But certainly, the more of us that are talking about this, whether it's in the hospital with patients who get admitted for respiratory illness, or us, where most of our time is spent in the clinics themselves with pulmonologists, I think it's only going to help bring more recognition to this disease state and the opportunities to help those patients that have this condition.
And as a single product company, I think it benefits you to be either different and or better than the competition. So I'd love for you to talk about the clinical evidence that backs up the efficacy and the maybe the differentiation of the SmartVest.
Yeah, well, I think, with this, and as I mentioned before, the one opportunity that I see from a market development standpoint is certainly, in the United States in particular, we need guidelines for bronchiectasis treatment, and today there isn't any. But that being said, we do have studies that are out there that, and I think this is really important, especially as you look at keeping patients out of the hospital, keeping patients out of the emergency room, which none of us like. But certainly when a patient who has been diagnosed with bronchiectasis and has what is called exacerbations, which basically their base level of breathing is compromised, once they start using SmartVest, we've seen that emergency room visits have been reduced by 75% for patients using our product, which is really exciting. In addition to that, we also see that exacerbations, which require hospitalization, so the patient presents, their condition has really deteriorated, they get hospitalized. But those patients who are using SmartVest, those hospitalizations have reduced by 59%. And as you know, hospitals don't want readmissions, payers don't want to pay for hospital visits. And so, to the extent that we can keep patients breathing well at home and keep them out of the hospital, we feel really good about the results of our product. I think lastly on that point, though, as I mentioned before, this condition is irreversible and it's chronic. And so, SmartVest doesn't cure bronchiectasis, but what it does, it improves a patient's quality of life who are suffering from blocked airways, again, to help them breathe easier and live a more active life.
And you mentioned that there's this lack of guidelines associated with the affliction. So I'm curious about why that is, and what does that represent in terms of a potential opportunity? If and what governing body would even issue those? Is that an FDA thing? Is that a Medicare, Medicaid thing? Just give us a sense of, because it seems like that's a really critical point here, for people to understand the potential upside.
Well, it's a great question. There are guidelines, but they're European based right now. I have met with some folks that are really focused on this from a KOL perspective, and these are people in really the NTM, which is a group that's really focused in this area. And they're looking to have guidelines that are published by the end of this year, hopefully in harmony with what's been produced in Europe. But I think there's always a competitive intellectual fight between the Europeans and the United States relative to clinical pathways. But I think that's going to be a nice first step. Today, really what the protocol is typically, patient will present, they've got an infection. The easy button is to treat that infection with an antibiotic, which makes a lot of sense. But that doesn't fix the underlying condition. And furthermore, patient still needs to be able to clear their lungs. And because of the reimbursement landscape, and I think this is an important thing to note, for people to get reimbursed for our product, they have to have tried and failed another device. They have to have had a productive cough for the last 6 months. And they have to have had a CT scan that confirms that they have bronchiectasis. And as long as they meet all three of those criteria, then Medicare will reimburse for the technology. So part of it is, that's a lot of hurdles to jump through for a patient to get our product. And I believe that's one of the reasons why they don't get on this therapy sooner rather than later. And part of our opportunity is to convince Medicare and some of the other payers that, look, you're waiting too long to get these patients on this technology. And if you got them on sooner, look at the kind of benefits you'd get. You'd get reduced ER visits, you'd get reduced hospitalizations, which are costing you a lot more money than the cost of our device.
And as I think about the device, it sounds like you have some unique IP. What would you say the core IP or technological prowess of this company is that has allowed you to create this technology that seems to have some differentiation?
Well, I think the big thing is there's predicate devices that are on the market. So when you take a look at our product versus a couple of our competitors, they're very similar relative to the mechanism of action, as I described earlier. I think what's differentiated about our product is the vest itself. We pay particular attention to what's important to the patient, and we try to organize our organization around our customer and start with them and then work backwards. And in that case, it's the vest itself. It's got to be comfortable, lightweight, or it's going to be uncomfortable for the patient to, wear for 30 minutes, 2 times a day to clear their lungs. So you won't get as good a patient compliance. We feel like our product's different that way. I talked before, and these are the little things: Velcro enclosures or snap or to hold the vest in place. Our competitors use clips, and those are difficult to navigate for a lot of our patients. The other thing that's unique about our device, and it's part of the IP of our product, is we have a single hose device. And when you take a look at about a bigger piece of a medical technology within your living room, we've got a smaller footprint. We have a single hose. Our other two main competitors have dual hoses, so it's more cumbersome for the patient. And it's just a lot more hardware that a patient needs to work with within their living space. So I think those are the key things. The ease of use of our product, obviously, we think is best in class. But also there's a big service component to what we do. And, because we're a direct organization, we work with the provider on getting prescriptions for our product. Then we work with, their staff and making sure that the patient navigates through the payer journey. And then we actually deliver the product to the patient's home and do the training there. And then we do 30-day follow-up after we've delivered the product. And we think that, full patient journey continuum is one of the things that really differentiates us in the market.
I mean, it's interesting. I mean, so much of healthcare is not delivered that way, right? There's a lot of intermediaries. You almost never, as a device manufacturer, you almost never touch the patient in at least in a consistent way. Is that why? Is that like, is that a historical accident that it was created, that the structure is that way? Is it deliberate? Is there something about the product that speaks to this? Maybe talk about the kind of go to market and the distribution and how, like, why it is the way it is.
Well, I think this, Ben. Most of our competitors or manufacturers, I should say, what they'll typically do is they'll manufacture a product, and in the home market in particular, what they'll do is they will then sell that to a DME or a durable medical equipment distributor, who then many times is responsible for creating demand for that technology and then delivering it to the patient. In our market and with our product, we talked before about market development. Today we still see SmartVest as largely a clinical sale, and we need feet on the street to educate providers and to identify patients who could benefit from our technology. So I think that's the key thing. We've realized that there's still a lot of education that we need to do. There's still a lot of face-to-face interactions that we have to have with providers. So having that direct sales team, I think, really makes a difference. DMEs, as you know, they're generalists. They carry many products, so focus and expertise are a challenge for them. With a single product company like Electromed, that's our bread and butter. Our folks wake up every day. They're experts in our technology. They're experts in the benefits it can provide to the patients. And by going direct, we not only control the provider relationship, but as we talked about, we manage the service. And, from a investor standpoint, we don't need to share the margin with the DME. So that's one of the reasons why we have such a robust gross profit margin.
Yeah, and we're going to talk a little bit about that in a little while. So you mentioned being a single product medical device company, and I know you get questions about this all the time. There are obvious benefits to it because you get to be focused and you have a single product versus maybe hundreds or even thousands of products for your competitors. So how do you think about trying to balance the opportunity, but also the risk, especially when it comes to reimbursement and, I don't know, recalls and things that happen, that can happen in this world, relative to
Yeah, no, I'm sorry. We do see this as a competitive advantage because we're experts on HFCWO technology. As we've talked about, we have the newest and most innovative product on the market with Clearway, and we're seen as a trusted advisor by the providers we serve. And certainly, I'm always looking at opportunities to further leverage our best-in-class sales team and also our reimbursement expertise that we have. But today it's difficult to find the right product to add to our portfolio. Mainly because our profit profile is so high. And what I don't want to do is distract our sales team in a market that we think there's still a lot of tailwinds to grow in. I don't want to distract them to selling a product that's lower value and diminish their focus on our key product line where we think we still have a lot of runway.
Got it. And so, often, CEO comes into a position and creates a 5-year plan. And, maybe part of your plan would be to have SmartVest, be, I don't know if it's 50% of revenue, 75%, but a lower percentage of revenue than it is now. Like what would, if you were creating that 5-year plan, looking from today, what would that look like? How, like, is there, is it acquisitions? Are there other revenue streams that you can develop? Is there data capture of some kind? I'm interested, like, how you would diversify your revenue base if that was a priority.
Well, we kind of talked about that just briefly, but, I think we've got a best-in-class sales and reimbursement team. And, I've been in the seat now for a year, and we want to stick to our knitting and complementary markets we serve in either pulmonology and or the DME space. And that could be, to your point, Ben, it could be product or service. I'm really looking at, as I mentioned before, though, it's got to be something that provides us with scale and or it's accretive to our profitability and not be a distraction to our high value product. And I'd love to say that I found that shiny object yet, but I haven't. But I do think, again, near term, we've got a lot of growth opportunity in the existing market that we play in with the product that we have. But I also do look at, could we expand what we're doing in the hospital space? That's a really interesting untapped opportunity for us, where we have a nascent share of mind and product and market share within that space. International, I don't think, is a huge focal point for us, nor will it be, because I think those markets are even less developed than the United States and could be a great deal of capital necessary to make those markets really get to where we need to be, and a distraction off of our core business here in the United States. So we're keeping our eyes and ears open. But again, I think we're really looking at, is there something within the pulmonary space where we are already calling on pulmonologists, and it would be a natural putt for our sales reps to have something new and exciting to talk to them about, or leverage some of our DME capabilities that we have that make us, in my mind, very unique.
And anytime you're talking about medical devices, the annoying topic of reimbursement comes up. And especially when it comes to Medicare and Medicaid, there's always this kind of specter of like, what do they think about the value of this product and what you should be paid for it? So maybe you could talk about, maybe just level set your exposure to private insurance versus kind of the government insurance programs, and then maybe talk a little bit about recent trends, like what has been the stance of the governing bodies and the decision bodies on the reimbursement side.
Well, we're really fortunate. I talked before, obviously, whether it's Medicare or it's the private payers, they see value in our technology and the benefits it brings to their patient population. Medicare today represents about 50% of our reimbursement. So we have a healthy amount of our revenue coming from Medicare. And this is the good news. We have actually seen annual rate increases, which are typically based on the urban CPI, Ben, and they're usually within the range of 3%. So unlike a lot of other medical technology where, if for instance, we were selling into a hospital and we had a competitive situation, we would be, and let's say, for instance, that hospital facility feels like our technology is comparable to a competitor's, and we start to get into a price negotiation, we're really kind of insulated from that in the market that we serve in the home market, which I think is a real competitive differentiator for us. And one of the reasons why I think we've been able to maintain such a healthy gross profit margin.
Given that response and the dynamic you described in the hospital, what is the opportunity in the hospital, and how do you approach it without sacrificing the gross margin profile?
Well, I look at the hospital as kind of a gateway to the home. I don't see it as just a panacea where we sell into the hospital market and it's going to do great things for our business. I really see it as, there's a patient that gets admitted, they've got they're pulmonary compromise, they've been diagnosed with bronchiectasis. Again, it's a chronic, irreversible condition. They're going to need our product or a competitor's product upon discharge. And really what I see is you get them on our technology within the hospital market with the expectation that upon discharge, they end up going on a SmartVest. And so We're dipping our toe into that. Again, it's a nascent part of our business. It's about 4% of our total revenue today. But I think that market too is being underserved. That's a capital sale within the hospital market today. So a hospital will buy, let's just, for argument's sake, buy 10 SmartVest, but they'll keep those units for years. And so you don't have a really strong and fast replacement rate. But what I do see is, yeah, it's a capital opportunity for us. That's good. So that helps with our absorption and manufacturing. But I also see that the opportunity is to get many of those patients that are getting discharged to the home. We did hire a couple of people to focus on that market this year. And the good news is our hospital business is up over 25%, albeit on a smaller base year over year from where it was last year.
And let's just say I've never used a SmartVest and I'm in the hospital and I've been hospitalized and maybe they're pairing it with an antibiotic to, whatever, to protect against a really bad outcomes. I mean, if you use this thing for, I don't know, a couple of days in the hospital, is it typically that you can see the results and the person feels the results almost immediately, so that there's this like, oh my goodness, this is, I need this thing. Why can't I need to take this thing home with me? Is it that rapid, or is it just more like over time you see a healthier patient?
That's a great question. I'd be lying to you if I said it's like having LASIK surgery. If you were nearsighted, it's not after you have the surgery. It's immediate. The effects are immediate. It does take some time, usually after a few days for the patient to see the benefits of it. And that's one of the reasons why, in the home market, we follow the patient journey. We do a baseline on their CAT score when we deliver the product to them. We follow up after 6 days after they receive the product, and then we follow up another 30 days to see what their progression looks like. And we provide that feedback to the prescribing physician so that they can see the benefits that the patient is getting on our product. I would argue, Ben, to your point, I don't think they're going to see immediate changes in their results in the hospital, but certainly, by being compliant with the therapy, they definitely will see benefits.
And we've talked about the attractive gross margin profile of this business, which is in the mid 70s. That would be the envy of many companies that I cover and I talk to. So we talked a little bit about the distribution advantage of not having to pay the DME in a lot of circumstances. Is that the only source of the margin profile, are there other things that people should be aware of as they're looking at this company?
I think our operations team, certainly since I've been here, has done an awesome job in product availability and looking for ways to lower our cost of goods sold, whether it's through negotiating better freight rates or looking at some of our raw materials that we use. So we're always looking at ways to lower our cost of goods sold. But as I mentioned, Ben, we're fortunate, in that we have payer contracts where we've had very stable pricing on our product. And so even when we introduced SmartVest a couple of years ago, one of the questions was, well, gosh, are you going to have a stronger ASP on that product? And the short answer is no, because that rate is pretty well fixed, with the exception of, what we're doing with Medicare, where they, have thankfully been increasing the reimbursement rate for our product on a year-over-year basis. But the other piece is for our patients. I talked about the value that the payers see, but the patients also see a lot of value, even in their copay, for this product. This is a condition that they're going to have forever, and our technology has a lifetime warranty. So when we deliver that product to the patient, and if they're using it for 5 years or 10 years, that patient can feel really good about the fact that they don't have to make another incremental investment in this technology. And I think that's another one of the reasons to believe in Electromed in our product line.
And if I were you and I was thinking about the way to maximize gross profit dollars, there could be an argument that if you would be willing to sacrifice 10 or 15 points of margin if you could work with DMEs across the country and have just many more sales through those partners. So have you thought about balancing that margin versus potential, ability to get more products into people's hands through partners?
That's a great question, and it's something which we have looked at. To that end, we are not exclusively direct. So on a very strategic level, we do go through DMEs.
Yeah.
And it's typically through a DME that has a pulmonary focus and I believe I mentioned this before, where they help us with some of our white space coverage, and making sure that our providers can get access to our technology where we might not have sales representation. The other piece is, there's certain markets where we don't have payer access. And by going through a DME where they have a payer contract, we might get a prescription for our technology then. But if we don't have the payer access, that payer may reject us and use a competitive product. And so in certain instances, we will go, and again, we're very strategic about this, where if it's a geographical play or it's a reimbursement play, we'll partner with the DME to carry our product. But we've got to be careful, because what we don't want to do is have a channel conflict with our direct sales reps. And so that's one of the things that we're really prudent about.
Yep. No, that was my next question. And so that makes sense. And we've talked a little bit about operating leverage and as you continue to grow revenue, it seems to me like there's a base expense that won't necessarily go up a ton as you grow. So as looking at their numbers, it looks like about TTM revenue is about 50 million. What does scaled look like to you? Is that 75? Is it 100 million? And then I'm curious, like at that level, where would you hope that EBIT or EBITDA margins are?
Well, Ben, I think in our last discussion, we don't give guidance, but I do feel we are scaling our business. We have communicated that we believe we can grow our top line double digits and improve our operating margin, which we've done. I mean, if you take a look at our results this year, we've had 6 quarters in a row of mid-teens revenue growth, but as you asked before about the inflection point with the company, I think one of the reasons why our stock has appreciated over 40% this year is because the street is actually starting to see that, boy, not only can this company grow, but it can do so profitably, and I certainly see that continuing.
And talk to me about capacity. So under the awesome circumstance where you get a lot more orders and maybe there's some guidelines issued that provide a tailwind. Talk to me about your manufacturing capacity. Can you service many more units given the current infrastructure base?
Absolutely. We're a single shift operation right now. We're in the process of actually reconfiguring our manufacturing layout. We've got awesome leader in our operations team with Steve Trinka. And so I think, not only can we get more throughput in the current shift that we have right now, we've demonstrated we can do that without adding a lot of direct labor. But I also think, as we grow, Ben, one of our opportunities obviously is we can add, a second or third shift. So I feel like, we're really in a good spot from a foundational standpoint to grow for the future.
And you have a slide in your deck because you talked about the stock appreciation, and I'm curious about the way that you're compensated. You have a slide in your deck about alignment that talks about your compensation structure. I don't see many people in their presentations talking about alignment with shareholders, and we should see a lot more of that. To maybe remind people about how you're compensated, and then talk about why you have that in the slide deck.
Well, let me, the bullet in our slide deck is that, my compensation is based on total shareholder return, and that management's compensation is based on improving our financial performance. And, I want to make sure that our investors know that the team and I are focused on increasing shareholder value. by growing both revenue and earnings before tax. And Ben, I believe if we're successful, both of us should benefit. And our shareholders are the owners of our business, and I want them to feel like we're good stewards of the resources that we've been given, and that we're looking out for their best interests as well. And if I'm not able to increase total shareholder return, then a big portion of my incentive compensation I won't realize. And I think that's great. That's the way it should be.
Amen to that. I'm all for it. We always tell people is that, like, if a CEO that you're working one of your companies does really well, they should make a lot of money, and the structure the structure should be created that way so that people have the incentive to try to do that. And we used to tell people at my old firm, like, you're underpaid, right, relative to and look, there's obviously a perception that all CEOs are overpaid and stuff like that, but tell me about the structure and we can talk about like whether you're underpaid or overpaid, how much value have you created for shareholders. So that's interesting. The other thing that I noticed when I was looking at your bio is that you are or were an operating partner of Shore Capital. I think I listened to the interview with Justin Ishbia, the one he did with Patrick O'Shaughnessy on Invest Like the Best. I think a lot of people have listened to it and kind of were just amazed by what they've accomplished and the intricacies and the uniqueness of that model. I would be very curious to hear about what you learned about M&A or culture or structure from being involved with that organization.
Well, first off, it's a great team and it's a great culture. I'm on one of the operating businesses that Shore owns. And they're actively involved in the investments that they make. They're really there to support the businesses, which I think is fantastic. But I think, what have I learned from, a culture standpoint is, it is about the people. When they have a thesis on a company and they're building, and they're going into that market, they don't start first with the company. They start first with the board. And so they want to make sure that, for the thesis that they built, they're looking forward to, who is that board that they should have to support that business. And I think that's really unique to Shore. And so that's one of the things that I've learned from them is, they want to make sure that they've got the right people sitting around a table that can provide guidance and support for that business that they're acquiring and growing to help them become successful. So I think that's really interesting. From an acquisition standpoint, the Shore model, a couple of things that I've learned is, the business case for the acquisition needs to fit the thesis of the acquiring business. And, that's one of the discussions that, we have a lot of times in board meetings is, the company that we're supporting has so many great ideas and is very entrepreneurial, but many times, you can focus on the useful many and not the vital few. And so I think as you're looking to scale a business and do so through acquisition, you need to make sure that those acquisitions are strategic fit. In Shore's model, as I think you're aware, Ben, they're really looking at smaller, typically privately held companies where it might be a fragmented market that they're going into. But you need to have a willing buyer who can see the value of becoming part of a bigger organization where scale and resources are an advantage. And if you don't have that willing partner, it makes the acquisition difficult. It could make it a lot more pricey, but you have to have that buyer who sees the bigger vision here. I think the last and probably the most important thing, and this applies to Shore or really any other company, is you need to make sure that you have a tight integration plan. Many times companies are so focused, predominantly the BD team, on the transaction. But once that transaction happens, you have all these people in the acquiring company who know it. They want to know what to expect. What's their comp and benefits? What's their role and responsibilities? How do they fit into the broader culture? What was the strategy behind this acquisition? How can they benefit from it? And I think Shore does a really nice job on that last point because I think that's so critical. Otherwise, you get a lot of churn. You lose a lot of the secret sauce from the acquiring company, and I think it's a real strategic advantage to do that.
Thanks for that. In that response, you talked a lot about culture. I think it's a good segue to talk about the culture at Electromed. What cultural values are you looking to establish, kind of as deep in the organization as possible at this company?
Well, it all starts with talent and making sure we have the right colleagues who fit our culture. Culture, respect, accountability, and collaboration to drive results. Those are key themes for me. And I think for my team, we just got done talking about Shore Capital. And like Shore, we too utilize the entrepreneurial operating system. Ben, I'm not sure if you're familiar with that.
No, I want to hear all about it.
It's really, a simple framework that defines what's important in the organization, who owns it, what exactly success looks like. And you really have this framework to align goals and objectives across the company. I think what happens a lot of times within companies I've seen is that each functional area has their own goals, but they don't really tie into the overarching objectives of the company, and that EOS system really helps harmonize that and give visibility to all the operating leaders, and then they can cascade that down to their teams as well. Electromed is, our culture is merit-based. We talk about my compensation. When I started, I changed the compensation for all the managers so that it's predicated on revenue performance and earnings before tax performance. And people are rewarded based on their impact and results. And I think people really have responded to that. Our Glassdoor rating is 4.4, which I think is a real testament to the impact our leaders are having and engaging their teams. And lastly, my mantra is focus on the vital few and not the useful many. So we don't waste time on non-value added activities, and I think the team appreciates that. When I came on board, there was a lot of meetings that I thought were redundant, that were taking up a lot of people's time. And, I just asked a lot of why questions. Why are we doing that? And giving permission to stop doing things that really weren't adding value.
At the very beginning of this discussion, you mentioned, inheriting a healthy company, and you hinted at the fact that, you hadn't always been in such situations where maybe you were taking over something that wasn't doing as well. Have you had to change your management and leadership style to maintain and grow versus kind of fix to then grow?
I wouldn't say I've necessarily changed my style. I think one of the things that's made me successful is I can come into a business and really understand the mechanics of how the business runs. And I've done that and what you need to do to make it successful. And we talked about the talent. I think that's so important. You got to make sure you have the right athletes on the bus, that everybody's, not to be, trite, but rowing in the same direction. I think that's really critical. And I'm very good at driving focus within an organization. I'm also, my management style is, I expect, I set high expectations, and I get the right talent, and then I get out of their way. And, my job is really to make sure that I provide our team with the tools and equipment they need to be successful. So that's kind of a foundational thing, Ben. But some of the learnings I've had where it's changed my perspective, we were talking about M&A before, and I have seen this in my career in some larger companies, which I'm going to leave nameless. But if you acquire a company, what you don't want to do is, Electromed them. Not that we've acquired a company since I've been here, but what I mean by that is you don't want to ruin, the secret sauce of the organization you're acquiring. Many times what I've seen is a company acquires a company and then they infuse all of their talent into that company, and they really ruin, the essence of why they acquired that company. I'll give you an example. My last CEO role, I acquired two companies, and I kept on their CEOs and I let them run their business for a time. One of them ended up retiring. The other one is still with, my last company. And little by little, instead of just overnight doing full integration on everything and really disrupting their business, I made sure that we collectively, understand, all of the elements of their business. We made sure we didn't disrupt things that were really important. We improved things that were, and we eliminated things that were redundant. So I think that's a healthy thing to do. The last thing I would say is sometimes the right decisions on paper may not be the right decisions for the business. And I'll give you an example. When I was running a business in Australia, we had done an analysis on one of our locations in Adelaide, and we were going to shutter this operation that was there because we thought we could support it out of Melbourne. And on paper, it looked like a great idea. We're going to save a lot of money. We felt like our service levels wouldn't be compromised. Well, then I went into that market to express to them what we were doing and why we were doing it. And I was talking to all of our key customers. Hey, out of trust, they said, Jim, we trust you and we appreciate why you're doing this. But just know that you've got a couple of your competitors that support this market. They're in this market, and we'll support you. But if you stub your toe, we're not going to give you a lot of chances for you to redeem yourself. And we had a lot of business that could have been at stake in that market. So I went back to my team, and many leaders don't like to change a decision once it's been made. But what I told the team is, I said, look, I've heard from enough customers, and the juice isn't going to be worth the squeeze on the operational and cost reduction benefits we're going to get versus what we could lose in revenue and profitability. Now, the upshot of that, Ben, is the customers in those markets became incredibly loyal to our company because we listened to them, and I think we made the right decision.
I love that story, and it's somewhat of an indictment of the believing management consultants and what they tell you from 15,000 feet about what you should do with your business. One thing that we haven't really talked about is the impact of changing technologies on this company, right? We're doing a podcast in 2024, and you can't talk about anything without talking about AI. But I'm interested more about the data side. Like you have a relationship with the end customer. You have a device that's on the customer all the time. To me, there's a data angle there that whether you're using it to monetize it or you're just able to become a better company with better technology and better service as a result of that data, or even to be able to provide it to regulators or governing bodies of some sort. I'm just curious about how you think about data and technology and the pace of change that we're seeing in the world today.
Yeah, I don't see us monetizing the data that we're collecting today, quite candidly. I think where I would see it, Ben, probably being more of a benefit is getting insights into some things that we should be doing differently to enhance our service or our product and to improve our market share position. So that's really where I see it. I know, the last company I came from in the overarching organization, they had a big focus on data. And again, you're dealing with a lot of, patient protected information, and, that's HIPAA protected. And I think you got to be really careful because in some instances, when you're collecting data, especially in healthcare, what you don't want to do is lose the trust of either the provider or the patients whose data you're garnering. And so I think you've got to be, very careful about that because that can open you up for legal issues. And then it can also open you up where there's a lack of trust because unbeknownst to the people whose data you're gathering, they may not want that data out there.
That's interesting. Thank you for that. That's there's a lot of focus on collecting as much data as possible in the medical field. It's just a much slightly more treacherous and risky strategy.
Yes. Yeah.
One thing I forgot to ask you about is you mentioned all of the hurdles that someone has to go through in order to get prescribed a SmartVest, and I was kind of like just taken aback by thinking that for anybody who has a cough for 6 months, that sounds like an awful situation. Are there incumbents, competitors, powers that be that benefit from that? Kind of like all of those hurdles that you guys have to jump through to be able to get to touch a patient? Or is that some legacy structure that potentially outlived its usefulness?
Well, I believe it's outlived its usefulness. We've got to convince the payer that it has. And I think that's really where the rubber meets the road. And I think, quite honestly, Ben, because those hurdles are in place, I think that's a bit of a moat for our business, quite candidly. Just maybe to back up, during COVID, during the health emergency, one of the stipulations that was waived for reimbursement for Medicare for COPD patients was you didn't have to have a CT scan for that patient. So they had to have had a productive cough. They had to have had, tried and failed another technology, but they didn't have to have that CT scan. Now, most pulmonologists with their patients, because those patients are typically referred from a primary care physicians, have had a CT scan, but during that health emergency, that was waived. And so what I believe we saw was that predominantly some of the DMEs who are benefiting from distributing competitive product, because of that waiver, they were getting patients on this technology that, they had to follow all the hurdles that are currently in place and were in the place in the past, would not have gotten that product reimbursed. And so one of the things for us that, I feel really good about with our team is, we've, even during the health emergency, we were very vigilant on the reimbursement side with the type of documentation we needed to make sure that we got full reimbursement. So again, I think it's a bit of a moat, but I also, as we talked about earlier, I think there's an opportunity to educate some of the payers about the benefits our technology brings and providers so that they can get patients on this technology sooner than later.
And aside from an antibiotic, what is the first, like if you say they have to have tried and failed another technology, what is that other technology that often doesn't work? Or what is that first line of defense technology that people prescribe?
It could be, compression, where somebody's beating on someone's back. That's probably I know that's a bit of the standard of care. So it's interesting, I've talked to even some investors who said, gosh, I've had a loved one and this person had bronchiectasis, so they had another respiratory condition where they weren't able to cough up their mucus, and chest compressions were the name of the game. So that's a form of tried and failed. There's also devices called OPEP. They almost look like a kazoo that somebody breathes into that promotes a cough. And so, there is other things that are out there. They're just not as effective as high frequency chest wall oscillation, which is our mechanism of action.
Got it. Yeah. Thanks. There's a lot of moving pieces here, and I think you've really helped people understand both the threats and the opportunities associated with this business. So we're getting near the close here, and I've got my two favorite questions for all of our public company CEOs. So the first one is, what are 3 or 4 things Electromed absolutely has to get right over the next few years for the stock to be a good investment for investors?
Well, this is, and it never changes for me. First, start from the customer and work backwards, specifically as we talked about in market development. We have an underserved patient population, and we need to educate our providers so patients get the benefit of our technology sooner. Second, we need to execute to make sure we're providing excellent customer care, which we talked about. If we do those 2 things well, Ben, I think consistent revenue and earnings growth will follow. And, lastly, we need to be good stewards of our cash through prudent capital deployment.
And what are the avenues for that? I mean, it sounds like acquisitions are on the table, but also, just you have to be very strategic and judicious with what company will fit both financially and strategically. So are you comfortable building up cash over time, or what's it's a good problem to have a lot of different outlets, but I think people would want to understand what the philosophy is as if you do scale and you do start to generate significant cash, where is it going to go?
Well, I don't think anything's off the table. So, we've done stock repurchase plans in the past. We just exhausted our last one this past quarter, albeit at a very small level to exhaust the last tranche that we had. So that's, that can be on the table. Acquisitions that we talked about are certainly, if we saw the right one and it made sense for our business, those are, always on our radar screen. But we are all, and not only that, but also, just having cash for operations. As you know, a quarter ago, Change Healthcare, which is part of United Healthcare, which is a exchange for reimbursement. They had a cyber attack, and that delayed payments to quite a lot of providers, and so that impacted many provider practices on their cash flow. Luckily, we've got a strong cash position, so it didn't impact our business, and we looked at a different third-party source, which we now utilize for that. But those are the kinds of things that can go bump in the night, and you want to make sure you have enough cash to maintain the business and do payroll and pay our suppliers. But obviously, as we build up more cash, we're looking at the best use of that capital for our shareholders.
Well, Jim, I think we've covered just about everything I want to cover. So we'll
Good.
close with the question I asked all of our CEO guests. And I think we've talked, we've danced around this, but it's always nice to hear it straight. What do you think is the most underappreciated aspect of Electromed as a company and as an investment?
I think it's two things. The strength of our culture. I think a lot of people don't realize that in the last couple of years, we've added a lot of experienced, talented, focused, and nimble leaders. We have an incredibly collaborative team that knows how to execute and is scaling for continued growth, which we talked about. And then I think secondly, on the investment side, and I think this is one of the things that makes us so unique, Ben, is, we're a MicroCap standout in that we're growing, we're profitable, we're generating cash, and we have no debt. So we believe our stock is undervalued and a terrific investor, and we're expecting to continue to grow and add value to our shareholders.
Well, we're going to look forward. You're about a year in, and so we'll look forward to having this conversation again in 3 years to see how many of these things that we've discussed came to fruition. So, Jim, thanks so much for being on Compounders. I've really enjoyed learning about you and this company.
Thanks for the questions, and thanks for the time. It's been great.